You and your partner just experienced the miracle of life. Well, now the hard part is just about to begin. You're bringing this newborn home from the hospital. New parents tend to have many questions and concerns, whether it's about feeding, changing diapers, or maybe even the appearance of a funny rash or some funny breathing. Today, I'm going to answer those questions and more and help guide you on your first 1 week home from the hospital on this episode of Ask the Doc, No Appointment Needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, founder and pediatrician here at Constant Care Pediatrics. On this episode of Ask the Doc, No Appointment Needed, I'll answer your questions in real time about newborn babies and all of the work that comes with it when we're home. Send in your questions via email, Facebook, or the All Health TV app. It looks like there's a question coming in now. Daisy. Hi, Dr. Constant. My husband and I are about to have our first child, and we're thinking about co-sleeping with our newborn. What are your thoughts on the subject? Well, Daisy, congratulations. And I would like you to watch a video from our colleagues to discuss co-sleeping. We definitely don't have an opinion. There is a recommendation from the American Academy of Pediatrics as far as what to do with your baby, how to put your baby to sleep safely, and what are some of the risks involved with co-sleeping. So let's take a look at this video.
Sleep can be a big challenge for parents with infants.
I think as parents, we're all desperate to get our children to sleep at night.
Dr. Angela Matkey, a Mayo Clinic pediatrician, says parents should be aware of products that are not safe for sleep.
There's lots of different products that are marketed towards families and parents to help guarantee to improve their sleep. But most of those products have been shown to not be safe for infants to be sleeping in, specifically anything that has an incline.
Other products like loungers and weighted blankets are also not safe for sleep. Dr. Matkey says when it comes to baby's sleeping space, keep it simple.
Make sure the infant is sleeping on their back with no fluffy stuff around them. They should be the cutest thing in their bassinet and their crib.
Sharing a bedroom with baby, especially for the first 6 months of life, can decrease the risk of sleep-related death by up to 50%. But the key is sharing a bedroom, not a bed.
We want them sleeping in their own flat, safe sleeping environment with no fluffy blankets or things that could get in the way and risk their breathing.
For the Mayo Clinic News Network, I'm Dee Dee Stephen.
So to reiterate what my colleagues just said, the safest way for your baby to sleep is in their own bassinet or crib without sheets, just flat sheets, without a blanket, without stuffies, without anything that could possibly be suffocating. I strongly discourage any parent from sharing a bed or sleeping space with their newborn. There are plenty other opportunities for you to bond with your baby, and sleeping does not have to be that opportunity. During the day, you can hold your baby while they're asleep and you're wide awake in the middle of the afternoon, sitting on a couch or in a safe place. You can hold your baby, you could snuggle with your baby, you can definitely bond. And as a mother that's nursing, you're bonding every time you offer the breast. But sleeping with your baby is highly unrecommended and is very, very risky. Looks like we have another question coming in, and this question is from Carlito. Hola, doctor. We brought our baby home from the hospital a few weeks ago, and he's been crying a lot. I know babies cry, but how can we tell if this is something serious? Also, what do you think about letting him cry it out for 10 to 15 minutes or so? Carlito, that's a great question because babies do cry a lot, and a lot is very subjective. What might seem like a lot of crying for you, for someone like me that's been around it long enough, probably feels like it's 2 minutes or 3 minutes. So it is a very good question, and you want to determine whether or not there's anything concerning going on. So when your baby is crying, the first thing to do is is check the time your baby last fed. And you want to make sure that they're feeding within an adequate window. Usually newborns feed between every 2 to 2.5 hours. So if you look at the time and you realize it's been an extended period of time without feeding, maybe that's going to be the first solution to the problem, is trying to feed your baby. If the feeding window is adequate and you know that your baby just fed and was just burped and should be comfortable, the next thing you want to do is check their diaper to make sure that their diaper is not only clean, but also is strapped on comfortably. Sometimes we might accidentally put the diaper on too tight and irritate their skin or make them a little bit uncomfortable. The next thing you want to do is look around at your baby's extremities. It is common and often forgotten that we shed hair a lot as adults, especially postpartum mothers, and the strand of hair can serve as a tourniquet on your baby, on their fingers, on their toes, and even in boys, sometimes on their genitals. So you want to make sure you do a quick survey of their body and make sure there aren't any foreign objects or a tourniquet and hair anywhere. And then finally, you usually want to try to swaddle your baby and then try to console them. And if your baby can be consoled, whether it takes 20 to 30 minutes or 10 minutes, as long as your baby can be consoled, then rest assured that everything is okay. The concern is when you have a baby that is inconsolable, and that's checking all of the things that I just mentioned, making sure that they're comfortable, holding them, singing to them, swaying with them. If they cannot be consoled in any way, then we need to step up the level of concern and either call your pediatrician, or depending on the time, if you need to go to the emergency room, you would go to the emergency room. But other than that, babies usually cry because they need something. It's just a signal that they're either uncomfortable, in distress, or need something. And you should usually be able to cater to those needs and calm them down. Good luck to you. Looks like we have a question coming in now from Waverly. Dr. Constant, my cousin had a baby 1 month ago, and I'd really like to see her. But my cousin asked if I had a Tdap vaccine. Do I really need to get one, and what is it? So Waverly, the Tdap vaccine is a tetanus, diphtheria, and pertussis vaccine. We all had the diphtheria, tetanus, and pertussis vaccine as we were younger, at ages 2, 4, 6 months, then 18 months, and then we had a booster at 4 years of age. And at 11, it is recommended that children get the booster, because that has the so that we could booster the tetanus component of the vaccine. So you'll still get the other components, but the tetanus is the more predominant, as well as pertussis, and that's recommended every 10 years. Now, we are recommending that families that have newborn babies, not only do the parents get the Tdap booster, because of course most of us had the last booster at 11 years of age, but also any caregiver or any person that will frequently be around the baby. That doesn't mean that every single visitor that comes by just once needs to be vaccinated against pertussis. And let me backpedal a little bit. Tdap is the booster for tetanus and diphtheria and pertussis. The reason why we want adults that are going to be around the baby to get this booster is because adults tend to get pertussis, and we are the ones that will pass it on to a baby. And pertussis in a baby is deadly. They can asphyxiate, they will lose their breath, they will go into respiratory distress. An adult that has pertussis tends to have a very long cough that doesn't get better, but it won't kill them. So the concern is for this newborn baby that's completely unprotected. We need to vaccinate against tetanus, diphtheria, but most importantly pertussis, to not give it to the baby. Younger kids are all fully immunized against this because they got the 2, 4, 6, 18, and 4-year booster. So younger children are fully immunized, and any 11-year-old usually has already had the booster. Again, so the recommendation will be for caregivers. If you're someone that's just going to visit the family to say hello and meet the baby for the first time, maybe see them once a blue moon, you don't necessarily need the Tdap vaccine, but obviously it is a nice gesture to get it done, and you will be protected, so it doesn't hurt to do so. And for the moms, you usually will have a Tdap, and that Tdap is good for each pregnancy, so you don't have to repeat the Tdap vaccine if there's a subsequent pregnancy. But again, caregivers, it is very highly recommended that caregivers that will be around the baby, or grandparents that will frequently be around the baby, get the Tdap vaccine. So if you want to send in questions and this is of interest to you, take a look at this video to see how to do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So it looks like we have another question coming in, and this question is from Madison. Hello, Dr. Constant. I'm having some trouble breastfeeding my newborn, and it's driving both me and my baby crazy. But I don't want to stop. How do I know if she's getting enough food? Should I consider giving her formula? Well, breastfeeding can be difficult. I totally understand. And might I suggest that you look into getting a lactation consultant that might be able to help you with this and just help you figure out a better routine for you and your baby. Now, it is important to know whether or not your child is being fed adequately. And a way for us to gauge this is number one, by their output, meaning their urine and their stool output. So your baby should be putting out 8 to 10 wet diapers a day and probably 4 to 5 stools a day, or poopy diapers, I like to call them in my office, per day. And also you should hopefully be going to your pediatric wellness visits, and at those visits your pediatrician is weighing the baby and measuring the height and plotting them on the growth curve. And if your baby is thriving and moving up and gaining weight on the growth curve, then we know that your baby is getting sufficient nutrition and sufficient breast milk. But if we see a trend down or maybe a little stagnant, then there is a concern with the feeding. So I really do suggest that you discuss this with your pediatrician and look at these trends and see if there's anything alarming. Now, as far as providing formula, absolutely. If nursing is not going well and your baby is not thriving or gaining weight, we absolutely want you to supplement with formula. The most important thing is that your baby is eating and gaining weight and thriving. While most people prefer to give breast milk for many reasons, there is nothing wrong with giving formula. So I think the biggest priority should be that your child is well fed. And then the second priority is deciding what it is you're going to feed your child. And like I said, I think that you should first discuss it with your pediatrician and see if there is even a need or an area of concern. And then if there is a concern, absolutely, let's supplement with formula and get your baby fed and healthy and thriving. So it looks like we have another question. This is from Isaiah. Hey, Dr. C, my girl and I just had our first kid, and of course I have diaper duty. I hate to be indelicate, but what's normal for a newborn? We're going through a lot of diapers. Right, so like I mentioned to the last caller, in the newborn phase, we want to see, at least in the first 2 to 3 weeks of life, we want to see about 8 to 10 wet diapers a day. That is normal. As far as the stools, depending on formula fed baby versus a breastfed baby, all in all, we want to see at least diapers a day. And this tells us that the baby is not only being fed adequately, but is well hydrated. So it is normal. Sometimes parents might be very concerned and they call me and they say that they're worried that their baby has diarrhea because they're stooling so frequently and the stool is also liquid in consistency. That is totally normal in the newborn phase. There's nothing abnormal about having 4, 5, 6, even 7 poopy diapers a day. The area of concern is when you start to see blood in the stool or maybe strands of mucus, or your baby is in distress during or after a bowel movement. Those are things that are concerning, but the frequency certainly is not concerning. It's definitely par for the course. So good luck on your diaper duty. So are there any other questions? Let's see, Chastity. Chastity, Dr. Constant, I'm a little concerned because my 4-week-old daughter's skin seems to be breaking out and peeling. She seems to be getting rashes. Is this normal? And what can I do? Also, how often should we be bathing our baby? Okay, so 4-week-olds, they go through a lot of skin changes. Remember, they're not going to have the same newborn skin that they had when they came out of the womb. So yes, there's a lot of peeling, or even, well, I call molting, which for lack of a better term, it's molting, and the skin just starts to peel and change because they're gonna have their older, more mature skin come in. The quote unquote breaking out, that is usually either erythema toxicum or seborrhea dermatitis. It depends on what it looks like. The red dots that are all over the body that are very bright red and they cover the face down the trunk, that's called erythema toxicum. It's not a breakout and it is not acne. It is completely normal and it resolves on its own. There's no need for medication or creams. It just resolves. Seborrhea dermatitis is different. It's a little more scaly. There's sometimes some yellow plaques, and that usually arises, it starts on the scalp and then spreads down the body. On the scalp, we call it cradle cap, and on the body, we usually just call it seborrhea. You'll see some yellow scaling on the eyebrows, behind the ears, and then down the body. And that sometimes we'll treat with like a steroid oil or an antifungal, or you could just leave it and it'll resolve on its own. But again, that is all very normal. It doesn't mean that there's an overgrowth or an infection. This is really just a normal variant of newborn skin. How often should you bathe the baby? So the recommendations are really just based on cultural preference and family preference. You do not have to bathe your baby every day. That is not required. The baby is really not getting that dirty aside from like poopy diapers and pee. So you could bathe your baby every 2 days, every 3. Some people like to bathe every other day. I will say that the baths are very soothing and they're very calming for the baby, and it's a beautiful ritual to have. So a lot of us like to incorporate it in our routine, but it's not necessarily that your baby needs it or needs to be cleaned. It's really just part of a nice routine. Okay, so it looks like we have a question coming in from Suzette. Hi, Doc. What's the deal with swaddling? Is it safe? Can it truly soothe the baby and help them stop crying and even fall asleep? Suzette, swaddling is amazing, and I try to encourage my patients to practice swaddling as much as possible. It was actually studied many years ago because it was very hard to calm down babies in the NICU that were really going through a lot of stress, and they had IVs and they have tubes in their nose, and their hours are switched around. And there was a study that showed that when you swaddled these newborn babies, they were calmer, they were soothed, they would stop crying, and then they would relax and fall asleep. So in my training, I learned how to swaddle babies in the nursery and in the NICU, because it was very efficient. So what you want to do with swaddling is you want to make sure both arms are by the baby's side so that they can actually touch their body and feel their body. So when you swaddle, the arms always have to stay by their side. What happens is some people let an arm slip up like this, and then they keep swaddling, and then the baby's upset and frustrated, and then they try to break the arm out of the swaddle. And yes, it is a total mess. The babies are unhappy, but that's because the arm was up. The arms both have to be down, straight down by the baby's side, and you have to swaddle your baby in a very snug swaddle. Not too tight where it impedes breathing, but not too loose where they can break away. So just snug enough so that it's almost like a weighted blanket. So you wrap them up and they have this weighted blanket. They feel their bodies. They understand where they are as far as like proprioception, because babies don't have a sense of where they are. They don't have a sense of where their body is. So if their hands are by their sides, they can feel it and they're calm and they understand what's happening. So then you just swaddle them, and you could even put a little blanket over the swaddle and tuck it in the size of the crib. I used to like to do that almost like a little strap, so they don't like flip over, like kind of just tilt over a little bit, and you just keep them nice and flat, and they'll sleep very nicely. And yes, they stay very calm. I practice swaddling every day here in my office. I hope that was helpful. If you have any more questions, or if I didn't address anything, please take a look at this video to see how to send me your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Well, it looks like everybody is really interested in this topic. As new parents, it's really difficult. We read so many books about pregnancy and what to expect when you're expecting and what to do and how to prepare for the delivery. But we really don't have many books or much information on what to do once this baby comes. And it's funny because you have a doctor that's following you for 9 months and that's right by your side and guiding you and helping you. But that doctor is not a pediatrician, and that doctor says goodbye to you after the delivery. So it is a really strange phase to jump in to the pediatric phase and find a doctor and find a confidant all of a sudden that can guide you. So I understand that this is a really rough period. So hopefully these questions and my answers are helpful to you. It looks like there's another question coming in. This is from Gina. My daughter took our newborn grandchild to the emergency room last night because the baby had a fever. She called the pediatrician first and she said, get the baby to the ER. I'm confused. Is a fever in a 3-week-old baby a medical emergency, and why? Yes, Gina, a fever in a, 3-week-old, absolutely. A fever in a baby under 3 months of age is an emergency. And this is because the cause of the fever could be many things. It could be a viral infection, which is harmless, or it could be a bacterial infection, which could lead to sepsis and even death. And the reason why we treat this like an emergency is because these infections get complicated much faster than they would in an older child. So we really don't have time to wait and watch and figure out what's happening. We have to act fast and we have to be preemptive. So that's why under the age of 3 months, any fever, we want you to go to the ER, or in some cases you can come to your pediatrician's office. It just depends on your pediatrician. And our job is to rule out a bacterial etiology of a bacterial etiology or a viral. And what we want to make sure is that the baby does not go septic, meaning the infection seeds into the blood and is throughout the body. If it's a localized infection, for example, an ear infection, we found a source of the fever, it is localized and we can treat it, then we're safe. But we can't just assume that that's the case. It is very important to be vigilant and to do a full sepsis screen and make sure that the child does not have a more complicated and severe infection. So what is a sepsis screen? That will usually entail blood work to check for their white count, to check for we'll check a blood culture, a urine culture. So we're looking for bacteria growth in the blood, bacteria growth in the urine, a chest x-ray to make sure there is no evidence of pneumonia. And depending on the severity of your infant, may or may not have a lumbar puncture, which is the what people call a spinal tap. And that's also looking for infection in the cerebral spinal fluid, because of course that can lead to meningitis. All of these things can cause very serious complications and even death. So it is very important that under the age of 3 months, if your child has a fever, which is 100.4 or higher, you do not treat with an antipyretic like Motrin or Tylenol. You call your pediatrician right away and decide with your pediatrician what the plan is to rule out sepsis. So your daughter did the right thing. Okay, so we have another question now coming in from Tori. How soon can we give our 6-week-old baby boy a little rice cereal with formula in his bottle? He just doesn't seem like he's getting enough food. And we're wondering if we can give him a little more food. Tori, that's a great question. Your 6-week-old baby really should be getting anywhere from 2.5 to maybe 4 ounces of milk per feed, and that should be more than sufficient. Adding rice cereal to the bottle is not truly advised. If your baby is not satisfied, you can just go up on the volume or go down on the frequency of the intervals that you're feeding your baby. But adding rice cereal is not as recommended. We usually add rice cereal to the bottle for babies that are suffering from reflux, from babies that need, or sometimes we use it to increase the caloric intake. So it's almost like a fortifier. We'll use the rice cereal or formula to fortify milk and increase the calories. And those are for babies that were either premature or have a congenital condition that burns more calories than usual. So we'll like to increase their caloric intake from 20 kilocalories to 22 or 24. But a healthy baby without any comorbidities that is formula feeding should be just fine with anywhere from 2 to 4 ounces of formula every 2 to 3 hours. Might I add that rice cereal oftentimes causes constipation, so maybe you adding the rice cereal might make your baby a little more full or rest a little bit longer, but sometimes you run the side effect or the risk of having a baby that now has constipation. So I would try to stay away from that. Let's see if anybody has any more questions. Let's see, Dane. Hi, Dr. Constant. How soon after we get home can we take our newborn out in public? That's a great question, and I probably answer that question 10 to 15 times a day, every single day. And I will tell you what I tell everybody else. Of course, having a newborn, your newborn does not have a full immune system that is completely immunized against all infections. We know this. But it's going to be many months before your baby is fully immunized. So I understand if you want to go out and explore with your baby and be in public, just try to be safe and not go to small places that are enclosed or have a lot of people. Maybe you want to take a walk outside in the park or go eat at a restaurant outside, but try to do it in a safe manner where you're not close to many people with maybe viral illnesses and cough. And you definitely want to be careful with school-age children as they tend to have a lot of viruses. That's all we have time for. Have a great day.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,